And good morning, everyone. My name is John Nelson. I'd like to welcome you all to our weekly COVID-19 vaccines Q&A Facebook Live. I am here today joined again by Dr. Brenda Ayers. So excited to have you back. For anyone who hasn't viewed any of these before, this is your first time, Dr. Ayers, could you just please introduce yourself real quick? Oh, by the way, my name is John Nelson, and I am with the communications team at New Health. I'm so used to it that I'm not even introducing myself. So, Dr. Ayers, go for it.
Thanks, John, and thank you for having me back again to have this discussion. Today we're talking about side effects, I believe, a very timely and important conversation right now. My name is Dr. Brenda Ayers. I am an internal medicine physician. I've been with New Health for over 11 years. I am also the director of the hospitalist service here at Vassar Brothers Medical Center, as well as Associate Vice President of Medical Affairs here at Vassar.
Well, we're so excited to have you back. And, you know, one of the benefits of, Facebook Live and doing things live is you can kind of, be agile and kind of change the topic a little bit. So we're going to touch on side effects today, but I think it's very important that we start today's discussion because of what's happening in the news right now, which is the pause on Johnson & Johnson vaccine. So can you talk a little bit about that and tell everybody kind of what's happening in the United States with Johnson & Johnson?
Yeah, so I so appreciate this opportunity to have this discussion today, right now. I think that this is a very important conversation to have. It's important that we speak transparently about what's happening, because what we can't afford to have is people to lose faith in our vaccine efforts against COVID, because it's really the only way that we're going to be able to beat this pandemic. I think that today's conversation is extremely timely and extremely important. It's important because I think that when you are addressing issues around vaccine hesitancy, that it is necessary to discuss side effects of the vaccine so that people know what to be ready for and what to expect after they've been vaccinated. And it's also timely because of the recent news, as you spoke about, John, with the J&J vaccine. So I'm sure probably everybody has heard that the FDA has elected to put a pause on vaccination with the vaccine produced by Johnson & Johnson. This came out of reports of adverse events, 6 adverse events where there was a clotting disorder found in women, 6 women, between the ages of 18 and 48. And so out of an abundance of caution, for multiple reasons, the FDA elected to put a pause on the distribution of the Johnson & Johnson vaccine in the United States. Now, I think the important thing to understand here is that, yes, is the timing of this terrible? Absolutely, especially with all the work that's been going on with vaccine hesitancy. The thing that I am encouraged about here is that it proves that the system works. The regulatory system, that the fail-safes that have been put in place by the FDA, by the CDC, work, so that when an adverse event is reported, we are offered the chance to learn about those things, as well as to stop and pause so that we can get more information about what exactly is going on. So the system is working the way that it's supposed to work. We now have new information we need time to process it. We need time to learn from it. And then decisions will be made going forward based on the outcomes. I can tell you that part of that process is that because of the 6 cases of the cavernous sinus thrombosis, which is the medical term for the blood clots that have occurred in these 6 women, out of almost 7 million doses, because of the nature of this, the FDA has called in an independent advisory committee that will independently review the information, the data, and help the FDA come to conclusions about what the next steps should be.
Well, it's you know, the context that you put there, 6 people, more than 7 million doses is important. But I also think, as you just stated, it's important for everyone, like every human life, every life is important. And to
Right.
me, that is such a testament to, everything that goes into emergency use authorization and the studies and all that. The fact that, 6 people, like whatever percentage that is, I'm not a mathematician, so I can't do that. But
It's less than, so you're talking about, roughly 1 in a million chance of this happening to you.
right. Which, so to me, like the amount of effort put into that is pretty stunning. So I will say, like one of the things that this ties into, especially when it comes to side effects, is one of the side effects that we don't, that doesn't really come up. You hear about aches and pains and all this stuff. Like one of the side effects, honestly, is fear, right? So people being afraid to get vaccinated because of something like this happening. But if you take in the odds and you take in the odds of you getting sick or having some sort of adverse reaction to a vaccine, as opposed to you getting sick and having some sort of adverse reaction to COVID-19, I think the odds are much more stacked in favor of getting vaccinated. Correct?
Absolutely, John. That's a great point. So, so as we talked about, so you have 6 cases out of about almost 7 million doses that have been given in the United States. So you're talking about roughly 1 in a million chance, 1 in a million incidents that this could happen to someone. What I can tell you is that COVID also causes clotting disorders that lead to stroke and end organ damage in patients, and it happens. The virus itself causes this, and it leads to terrible outcomes, stroke in young people and things like that. And it happens much more frequently than 1 in a million. So again, as you're talking about risks and benefits, right now it's a moot point because all the J&J has been put on hold. But should the FDA determine that this is actually safe for use, or that these cases are not related, or that we maybe potentially follow the model that they're using in Europe, where the AstraZeneca vaccine had a similar adverse effect. And so now they may be reserving it for certain populations, say older people, where they're not noticing or they haven't found these adverse events. That remains to be determined. I think the important message here is that we cannot let the side effect of the fear derail all the efforts for vaccination, which still remains very necessary, as COVID is still killing people. And already the experts are predicting another terrible winter for us with regards to COVID. So I think that really hones in on why we have to continue with our efforts, and we can't, we take in the information, okay, we process the information. This is why the transparency is important and the conversation is important. And then we make our decisions based on the best information that we have at that time, weighing risks and benefits. And I agree with you. We do have to be agile. Over this last year, we're still learning so much about this virus, right? The studies, the trials for the vaccines are still ongoing. But what has not changed over this last year is the terrible impact and mortality rate that COVID virus has. That has not changed, right? So we know that. So we take the information that we have at that moment and we make the best decisions that we can. What I will say is that the Moderna and Pfizer vaccines have not been shown to have any of these clotting adverse events, right? It uses a different technology than the Johnson & Johnson and the AstraZeneca vaccines. And worldwide, there have been hundreds of millions of people who've been vaccinated, and no one has reported this for either the Moderna or the Pfizer. And so that's in keeping with the FDA's recommendation that Pfizer and Moderna are safe. So that if right now Johnson & Johnson is not available, we put that on pause. And so if you were scheduled for a Johnson & Johnson vaccine, let's switch over to Pfizer and Moderna. Get vaccinated.
Okay. Get vaccinated, right? Absolutely. And at the end of the day, that's the most important thing. So, switching over from Johnson & Johnson, we're more than happy to answer some questions, about that, of course. Let's talk a little bit about, the subject at hand today, which is side effects, right? So, a lot of people out there getting vaccinated, you hear stuff about someone feeling arm soreness after their first dose, or getting a fever or rash or aches or something like that after their first or second dose. Can you talk a little bit about the side effects that people will likely experience, and why when they get vaccinated?
Absolutely. And so first, I just want to make the distinction between side effect or adverse reaction and an adverse event, right? So a side effect is usually of a say vaccine, for instance, right? During trial, these are usually identified during the clinical trials, and they are reactions that are associated with the vaccine. They usually resolve on their own after a couple of days. Now, depending on the severity of the adverse reaction, it could be classified as an adverse event. Now, an adverse event is something that it causes permanent disability, hospitalization, life-threatening illness, birth defects or congenital defects, and death, right? So the way that we keep track of these is through the Vaccine Adverse Event Reporting System, or something called VAERS, which is a national thing that anyone can use to report any type of side effect or adverse reaction or adverse event. And that is actually how the cases with Johnson & Johnson came to be noted, right, through this reporting system. So again, these are the fail safes. These are the checks and balances that we put in place to make sure that in the long run, we're safe, okay? So as far as the vaccines go, I think, I read that as of April 12th, about 74 million Americans have been fully vaccinated, which is amazing. Still not where we need to be, but definitely better than where we were a couple of months ago. So that's amazing. Mm-hmm. Now, what you expect those 74 million people to have after the vaccination is a little bit of arm soreness, as you spoke to, muscle aches and pains, low-grade fever, fatigue. So these are the very common side effects that were observed for participants in the trial, and actually has borne out for people who've gotten the vaccines. I think I was actually reading something the other day that was stating that for the Pfizer and Moderna vaccines, that the prediction for the severity of the side effects or how intense the side effects would be actually has shown to be less in the real world than in the clinical trials, which is encouraging. And the reason that you get these side effects is with this arm soreness, the fever, the fatigue, the muscle aches. It's because this is exactly what you want your body to be doing. This is exactly what you want to be feeling after you've gotten vaccinated, because it means that your body is working to make antibodies against the virus.
Okay.
So that's the immune response that that you want your body to produce.
And how long do those typically last? Like, so is it like a day? Is it a week? Or like how long do they last?
So it varies. So I know people who've gotten both doses and had nothing more than a little bit of arm soreness. I know people who, after their second dose, usually they say the second dose gives you the more intense side effects. Um, they felt a little achy, a little sore. For myself personally, I will tell you, after the first dose, I was a little fatigued and it passed within a day. That second dose knocked me on my butt. It did. I will not lie. But I was prepared for it. I knew what to expect. I knew the possibility and I planned for it. But after a day, I was up and back and it was completely fine. Most people, in general, these side effects resolve within a day or two.
Okay, and so we did have a question that was sent to us in advance of today from someone who got their vaccine like 11 days or 12 days ago and is still experiencing, some level of, achiness, some fever, things like that. What should a person who's experiencing those type of symptoms do?
Yeah. So just to be clear, right, that you don't reach for the Pfizer and Moderna, you do not reach full vaccination status until 2 weeks after the final dose. Okay, so after that second dose, 2 weeks after, you're considered to be fully vaccinated. Okay, that's just the time that it takes in general to get your immune system revved up so that you're protected. And if someone is still, for this person who's still 11 days out, experiencing these types of symptoms, I would encourage you to see your medical professional, okay? Because that is beyond the average, beyond the normal that's expected. And, we would keep our fingers crossed that hopefully you have not contracted COVID during that window period where you're not quite fully vaccinated. You've gotten the vaccine, but not quite fully vaccinated. Also recall that, COVID isn't the only virus that's out there, right? I know that we've forgotten about all the other things that we were dealing with before the pandemic. For a couple of reasons. One is because we actually haven't seen them, because again, these things that we all had to do to protect ourselves, like washing our hands, wearing masks, and socially distancing, not only does that help reduce the rate of COVID spread, but it reduces the rate of spread of other communicable diseases like the flu, like the common cold, and other things that people are often plagued with. So we actually have not seen that over this last year to the degree that we've seen previously prior to the pandemic. So I would encourage that person to reach out to your healthcare provider and get evaluated and make sure, get tested for COVID, and make sure that you don't have some other viral illness or something else going on.
Gotcha. And that makes sense. I mean, I think that we all, like, the second we have any sort of symptom of anything these days, if you're in your house and you sneeze, you're like, oh, what's going on? And it could be allergies, or it could be
right.
the flu, or it could be just a cold. So, go ahead.
Yeah, that's a really good point too. So just sort of dovetailing with that question about, what do I do? Also recall that when we talk about, efficacy of the vaccines, the Pfizer and the Moderna, that they were great. They were 94, 95% effective in protecting us against the virus, but that's not 100%. Right? So if you're talking about, we have over, 100 million people who've been vaccinated, and it's 95% efficacious, then 5% of that 100 million people may still have breakthrough COVID, right? The benefit of getting vaccinated, even in that case, is that what we have found when we do have breakthrough cases is that if you contract COVID after you've been vaccinated, your symptoms are mild, right? You're not going to be on oxygen. You're not going to require hospitalization. You're not going to require a breathing machine or death even, right? Mm-hmm. So that is still the benefit for being vaccinated. It's not 100%, but it protects us still from severe illness.
Okay. Well, we do have another question from someone who sent to us before they wanted some advice. They got their first Moderna dose on, earlier in March. Then they became COVID positive and were actually hospitalized. And they're due for their second vaccination, but they weren't physically ready to get it. So their doctors told them that they can schedule their appointment at any time, but they want to know, are they going to have to start all over with the first dose, or can they just get the second dose and be done with it? And they just don't know what the answer to that is. So can you help with that?
Absolutely. Yeah, so you can get the second dose, right? So you have, I know the window is 3 or 4 weeks, depending on which vaccine you get, Pfizer or Moderna, for that second dose. But you have, the FDA says you can extend that out. CDC says you can extend that out 6 weeks or more. And so if you're feeling up to it and you've recovered from COVID, then absolutely go ahead and get the vaccine now, the second dose.
Okay. And do we know anything about like long-term side effects? I mean, is there, obviously it's probably too early, but we do have someone who wants to know, like, is there any like indication if there would be any long-term side effects from the vaccines?
No, none of the studies have shown, particularly the Pfizer or Moderna, any long-term side effects. Again, most of these resolve within a day or so after receiving the vaccine. What we do know when we talk about long-term effects is that there is this phenomenon with certain people who have contracted COVID, actually contracted the virus, who are what is being called the long haulers. So they have these chronic fatigue syndromes, they have cardiac issues, they have pulmonary issues that cannot seem to go away as a result, to the point that the incidence is to the point that many healthcare organizations are actually setting up treatment plans and regimens and clinics for COVID long haulers.
Okay. And another question that came in is someone who just, recently got the Johnson & Johnson vaccine before it was put on pause. And they want to know, like, is there anything they should do? Just behave as normal? Like, is there anything specific they should be monitoring for?
Absolutely. Great question. So, so the answer to that question is, if you've just gotten the Johnson & Johnson vaccine, within 3 weeks or so, within the last 3 weeks, then you definitely want to be watching out for headache, back pain, abdominal pain, leg pain. Okay. And if you are experiencing any of these symptoms, then definitely seek the attention of a medical provider. What the evidence so far shows, based on those 6 cases, is that most people presented with their clots around day 15. So the range was, I think, 6 days to, I forget, somewhere in the teens, but the average around day 15. So within 2 weeks of getting the vaccine, the people had these adverse events. So if you're 3 weeks, 4 weeks out of your vaccine, you're the J&J vaccine, very unlikely to have these adverse events with clotting.
Okay. And so when it comes back to side effects, someone has commented and asked, like, they heard that the side effects aren't as strong for Pfizer, but that's not really the case, right? It's kind of like it's a case by case basis, right?
Absolutely, because it really does depend on the interaction of the vaccine with your own immune system and your own internal environment. So I've seen people who've had mild reactions to both Pfizer and Moderna. I've seen people who've had less mild reactions to Pfizer and Moderna.
Okay. And how long are these vaccines going to last? Do we know? Are we going to have to get vaccinated again, or does anybody know?
No one knows right now. And it's a great question, John. No one really knows right now. What we do know is that most recent data looking at, I believe it was the Pfizer, people in the original Pfizer trial, at 6 months after vaccination, they still had 90% protection against COVID. So we're going to learn more the further we get out from the start of the trials, but so far so good with
Okay.
regards to holding up at the 6-month period.
And so if someone now like is, you know, reading the news today, or they're watching this Facebook Live and they're, you know, kind of on the fence, they're not sure, you know, and now that the Johnson & Johnson been put on pause, you know, like they're kind of on the fence, like what would you say to this person? Like how would you try to address their concern or fear?
Yeah, no, I would say I completely understand why you have that fear, why you sort of paused in your own thinking or eagerness to get the vaccine. What I can tell you though is that now we have over 100 million people who've gotten the Pfizer and the Moderna vaccines, and we have not had any adverse events being reported to this point in either of those. Those vaccines remain safe. And it is important, it is critical, because we are not going to be able to beat this pandemic unless we get vaccinated. I know that, I'm surprised we didn't get a question about what was the Johnson & Johnson, were these vaccines made too quickly, and because of that we didn't know about this potential connection to the Johnson & Johnson vaccine and these blood clots in these women. My answer to that is, so as we talked about earlier, the incidence is about 1 in a million. Right, for these types of clots that we're seeing in people who are vaccinated vaccinated with the Johnson & Johnson vaccine. So the trials are done with tens of thousands of people, not millions. And so if the incidence is 1 in a million, we would not have known that until we got to the point where we vaccinated 6 or 7 million people. Right. So it's not that the trials were rushed. It's just that with any type of vaccine or any type of trial, you do have to reach a sort of a critical number of people sometimes before things become known, right?
Okay. And one thing I wanted to mention, and this is third hand, I was told this from a colleague, but I did want to share this on today's Q&A. Apparently, one of the women who had gotten the clots from the Johnson & Johnson vaccine was interviewed on some of the one of the news shows this morning, and she talked about what happened to her and her illness and stuff. But at the end of the day, she did say that she would still have gotten vaccinated, and she still was encouraging folks to get vaccinated, which I think that says a lot there. Someone who experienced an adverse event, as like you're mentioning, still thinks that it was worth it to get it done. So I thought that's worth sharing.
Absolutely. I would just tell people that the system is working. The fact that the FDA is recommending this pause is not saying that vaccines have failed. What it's saying is that the system is working. It's giving us a chance to investigate these cases more, to determine if there actually is a cause and effect between the Johnson & Johnson vaccine and these type of blood clots. It's also giving the FDA a chance to push out the information to healthcare providers, right? Because this particular type of blood clot is extremely rare in the general population. And it's also associated with a low platelet count for some reason that we're still investigating. And that's the medical term for that is called thrombocytopenia. So, and it's unusual to have a blood clot, in patients with low platelet counts. Platelets are those factors in your blood that are responsible for the clotting. And because of that characteristic to this clot with the low blood platelet count, you can't use traditional blood thinners with these types of clots. So it's important that we put a pause, we put brakes on it so that the information can get out to the healthcare environment, where if I see a patient who has recently been vaccinated and is presenting with headache or belly pain or arm pain, now I know that, okay, this patient may have a clot, and I can't treat this clot how I would treat, more common types of clots. So it's important that we put a pause on that. And it also gives people the chance to report any other cases that may come about as well. So this is a system working the way that it's supposed to make sure that we are protected in the long run.
Absolutely. So hard to believe, but we're already at 30 minutes. So I will say, if you're interested in more information, you can always visit our website, newvancehealth.org. We've got tons of FAQs and Q&As and everything on our site to talk about vaccines. You can always comment on our posts on social media, and we'll try to answer your questions. And if you're out there and you want to get an appointment, go to vaccinefinder.org or go to your state's website or your county's website. And there are appointments out there, and there's lots of Moderna and Pfizer. And Dr. Ayers, I want to thank you again for joining us today. It's always a pleasure, and we look forward to having you back again very soon. Have a wonderful day, everyone.
Thank you.
Take care.